So, hello everyone. This is our Woman Today YouTube channel, and today our guest is Dr. Priya. So, she is a child pediatrician from Ludhiana. So, I welcome you, Dr. Priya, to this Women Today YouTube channel. Good afternoon, madam. How are you, madam?
Good afternoon, Krishna. Thank you so much for having me here. I'm doing very well. How are you?
Yeah, I'm fine over here. And please introduce me about yourself, madam, because I know about you, but the audience do need to know about you. So, please introduce about yourself, ma'am.
Okay. So I'm Dr. Priya Sakte.
Okay.
I'm from a small town in Maharashtra called MIRAJ. Currently,
Okay.
I'm working here.
Okay.
I've done my specialization in child health, which is pediatric.
Okay.
I did my initial degree, the diploma in child health in Ludhiana, like you mentioned. And thereafter, I worked in Hyderabad, where I did my DNB, which is another specialization degree in pediatrics. And currently I'm back to my hometown. I've been in the field for the last 7 years, 8 years running now in the field of child health. Before that, I did my MBBS in Sangli, which is close to my hometown. So yeah, here we are now.
Okay, ma'am. So, at what point did you decide that in doctor, as a doctor, you want to be as a specialization in child pediatrician, ma'am? So, there are
What
different
did you say?
departments in
Echo.
doc. Yes, tell
Yes.
me, ma'am.
No, sure. You go ahead. I think
Yeah,
there's a
there are
lag.
different departments actually. So, which made you choose that you should be a specialist in child pediatrician department?
Uh, that's a very good question. So, when I just finished my MBBS, which is the basic course we do in the medical field before we specialize, we have an internship during which we work in different departments. We rotate through different departments. So, until that point, I was very sure I want to work in adult medicine, which is general medicine. But my very first month of internship was in the department of pediatrics. And I absolutely loved it. It was crazy busy, it was extremely hectic. And I saw the people who were then training to specialize, they were insanely worked, but it was so rewarding. And I also liked the mental challenge of a child who cannot often tell you what's going wrong, but you have to deduct it. It's more like an investigative detective work that you have to do along with being a doctor. So that definitely was very challenging and very intriguing to me at that point. And that's when I decided that, yeah, this is what I want to do. And thank God I actually got to pursue it.
Yeah, that's a great thing you're actually doing to the society by actually telling the minds of the child, because it's very difficult. Even we can judge other people's mind like an adult mind, but it's very difficult to judge what's running in a child's mind. And after judging it, we have to give the treatment accordingly. So that's what you're doing
Yes,
right now. That's great, actually, madam. So here we are going to
thank you.
questions which is generally asked by many people over here regarding child pediatrician in department. So regarding about general health, so what is the ideal vaccination schedule should everyone prefer for their child? What is the ideal vaccination schedule? When should they provide with the vaccination, and what is the correct age which should be administered for
Yes.
the kid?
Yes, so this is very commonly asked. So every country has a different schedule. I'll speak in the Indian context. The vaccination starts right at birth, and usually it's more frequent in the first 3 to 4 months. So every month after birth, you have one vaccine until the age of, say, 3.5 months. So then after that, at 6 months, 9 months, 12 months, there are different vaccines. And thereafter, you have maybe two vaccines a year till the age of 5 years. Now, this is where people often get it wrong because they think 5 years stuck, it's all done. But we actually have more vaccines at the age of 10 years and 15 years. So these are often missed by people. So that is one point I would like to drive in, that vaccination continues till the age of 15 years
Okay,
minimum.
right now, even after, even before 15 years, they are administrating this vaccine, right, ma'am?
Yes, absolutely. So up to 5 years, it's more frequent.
Okay,
And thereafter, you just had about like two, three more visits.
okay, ma'am. So, how often should a child visit hospital and do a checkup with a doctor, ma'am, for this purpose?
Yes. So in the initial 6 months, I usually say 3 to 6 months, it's best to visit every month. And that automatically happens because the first 3.5, 4 months, there's a vaccine every month. So you already are going to the hospital. So we say this because in the first 6 months, there are many changes that can happen that need to be detected by your doctor. and thereafter maybe 2 monthly, 3 monthly visit till the age of 2 years. This is important because maximum development of a child happens in these first 2 years. So if there's any lag, if there's any issue, the earlier it's picked up, the better. So up to 2 years, I would recommend more frequent visits. Thereafter, even once a year is enough just for a general health checkup if the child is not sick otherwise.
Okay, then. So, what are the actually common child illness? So, what is the common illness which is frequent in every child and for which the parents bring their kids to the hospital? What is the frequent and common illness which comes to every kids over here actually?
Yes, very common is especially in this season is the common cold, cough, flu, which is very common. It normally happens in almost every child, even in adults. Up to 2 to 3 episodes in a year is quite normal and acceptable. If it's anything more than that, we would look into it, that why is the child getting sick that often. Apart from that, the gastric illnesses like diarrhea, vomiting due to some infection, that's also very common. Diarrhea being more common than vomiting. So these are more common in the under 5 age group because as the child grows older, their hygiene improves. You can instruct them to take more care, wash your hands and all. Before that, they're dependent on the parent. So yeah, these are the most common we usually encounter.
So this kind of illness comes from the basic, it depends upon the nutrition and diet the child intakes. So what nutrition and what diet do you recommend to the kids for below 10 years? What kind of nutrition should they intake avoid all this kind of illness in their life for kids below 10 years?
Yes. So up to 2 years, obviously, it's going to be a little different because the baby is also taking mother's milk or external sources of milk. So up to 6 months, it has to be exclusively breastfed, if not possible, formula fed. 6 months to 2 years, we'll try to introduce more of solid diet, start reducing the milk. Now, beyond 2 years, 2 years to 10 years, which you mentioned, this is the age where the child should be maximally on solid diet, which is very similar to the adult diet. A lot of people still continue feeding a lot of milk beyond 2 years of age, up to 4 or 5 years. And that's where things go wrong because milk does not contain enough nutrients, enough iron, enough vitamin C, which in turn will reduce the immunity of the child because they're not eating enough of other foods. So, what I would recommend, what anyone would recommend, is more of solid food, home cooked food, including more vegetables and seasonal fruits because they are the major source of vitamins and minerals at this stage. And if they're non-vegetarian, they can include meats, eggs, and reduce junk, processed foods, packaged foods as much as possible.
So speaking about milk, you prefer that we should intake milk in a limit. So what is the limit do you consider? How much liter should be consumed for a child in order to maintain the nutrition in the kid's body? How much milk should they consume actually?
Yes, so beyond 2 years of age, ideally breastfeeding should be weaned off by then. 2 years is usually the cutoff. And if the child is taking any external milk, 300 to 500 ml a day is the maximum that they should be taking because any more than that is going to compromise their solid intake. So that's the maximum. And one more point I would like to add is a lot of parents get very worried if the child is not drinking milk beyond 2 years of age. Actually, that's not a point to worry because milk exclusively is not doing that much of benefit to the child. So if the child is not drinking, let it be. Let them eat food. It's fine. It's completely fine.
So if not milk, what can the children take like nuts, eggs, and what kind of items should they not intake to avoid all kind of allergens? So what should they intake? Like can they consume eggs, nuts, and other things? And what kind of things they should not consume so that to avoid all kind of allergens?
Very good question. So with time, the allergic tendencies in children and adults are increasing. We're seeing that all around us. So there are certain foods, like you mentioned, eggs, nuts, certain fruits like pineapple, certain shellfish, crabfish. These are the foods I would not say that you shouldn't give it, but when you're introducing it for the first time, you just need to be more vigilant, more aware, look for any reaction. And ideally, it should be introduced after 6 to 8 months of age, not nothing before that. Now, when these foods are introduced, give it in a very small quantity, observe for a little while, look for any rashes, any fever, any breathing difficulty. If there's no issue, you can continue with it. But if there is any issue, just be prepared that you may have to take your child to the hospital, at least the first or second time. Beyond that, it should be completely fine.
So other than nutrition and diet, people are always concerned about the development in their child. Like what certain parents are worried about that. Okay, the child is not crawling properly. The child is not eating properly. Even the child is not walking properly. So at what
Yes.
age is the recommended age for every babies or every kids? Does it mean that every kid should start crawling or start walking in a specific period of time, and what if they are not doing it at the recommended time?
This is a great point to bring up because often people compare it with another child of the same age. So now let's take the example of walking. There is a range of walking, normal range, which is 12 to 18 months. Between this range, a child starts walking, it's absolutely normal. Now, there may be a child who started walking at 11 months. There might be another child who started walking at 18 months. Scientifically speaking, both are within normal range. But the parent whose child has started walking at 18 months might feel that, oh, my child is 7 months late, there's something wrong. But that's not the truth. So, every milestone has a range, a scientific range within which it should happen. So in case a parent has a doubt that, my child is probably delayed, has not started walking. So in this case, it's best to go to a pediatrician and get it confirmed because sometimes it's just a false fear. It's just lack of knowing what is the right time to start. So crudely speaking, I would say for walking, anything beyond 18 months is considered delayed, but under circumstances. So needs a checkup. And not speaking any words beyond 2 years of age definitely requires some examination.
Okay, examinations. So if about examinations, and if one wants to encourage one's children's cognitive development, what one should do to improve the cognitive development of a kid?
Very important in the context of this day because right now a lot of parents, out of desperation, out of need, are handing over their phones or tablets or TVs to children at a very, very young age. And this is becoming a number one factor that is hindering the cognitive development of children. Because in the past, children could look around, play around, move around. Nothing was holding them down to one position. So that actually, till the age of 2 years, that actually helps the brain develop. Any stimulus, whether it's different colors in the world, whether it's different environments that they see around them, playing with people, hearing their parents talk to them within themselves. So now, the number one point I would say is keep the screen away from your child for as long as you can. I know it's impossible to say don't use a screen, keep it away as long as you can. Involve yourself more in playing some interactive games with your child. Maybe it's just conversation, maybe it's telling them stories, maybe it's just taking a toy and playing with them. Things that our old school generations used to do with their children. Let's do more of that now, which will definitely help them in their cognitive development, especially in the first 2 years of life. And the more you stimulate them in this age group, the better it will be later on for them.
Because speaking about the screen time, nowadays kids are not eating without seeing a proper, a proper games or anything like that.
Yeah.
Because people used to hand over the cell phones to the kids.
Yes.
And they are spending a lot of screen time over here, because without it they are not having a proper sleep, they are not eating. And because of this, if this kind of things leads to the child to the autism mode, so what is the sign in order to bring to the notice of the parents that their own kid is going in the autism way or any kind of developmental issues?
Absolutely, yeah.
Yeah,
So,
what kind of
there are a
signs
few
actually we
signs.
should see?
Yes, yes. So I'll just mention a few signs. Autism is a spectrum. It can range from very mild symptoms to very severe. But for the general parents, the general population to know, I'll just tell you about a few signs. So one is not speaking beyond 2 years of age, not using words to communicate. Then another one is not making eye contact. When you speak to the child, they're not looking directly at you. Usually this starts at around 3 to 4 months, but even by 1 year, 2 year, if you see your child is not looking at you. Another one is making very repetitive movements. So some children do like a twisting movement. They just sit in a chair and keep rocking continuously, or they'll keep spinning around repetitively, not just for play, but continuously, repetitively. then having a very strong reaction to bright lights or loud noises, more than the usual, more than a normal child, very, very averse to it, not able to tolerate it. So these are just a few signs that parents can notice and should go to the doctor and get checked in case it is autism, because these are usually the early signs. So then they'll do a detailed evaluation to diagnose if it is autism or not.
Yeah, okay. Speaking about autism and speaking about the behavioral conditions of the kid. So, if one's kid is very hyperactive and if they show very much temper, and if the kid is very aggressive even at a small age, so what should one parent do in order to avoid all these kind of situations? What if a kid is always hyperactive and always aggressive, and what happens and what one parent should do in order to avoid all these kind of situations?
Right. So this type of behavior could be due to two reasons. One is a product of the environment. I'll speak about that. The second is that maybe they truly have issue due to which they are acting out this way. They're hyperactive, they're not able to pay attention. So that is something known as ADHD, which is a condition that requires treatment, for which you do need to go to your doctor and get treated. Now let me speak about the environmental issue, which is that the child doesn't have an illness, but because of maybe how the parents are treating the child, maybe they just allow the child to have their tantrums, given to the tantrums. Child is throwing a tantrum, ki, I want this, I want that, and instantly it is given to the child. Factors like these can actually encourage more of this tantrum throwing, hyperactive, excessively rageful behavior in a child. So, as hard as it is to say no to a child, sometimes when you know that, okay, this is not good for my child, a parent has to say no, maybe gently, maybe with love, but they have to say no, because this is causing behavioral issues in a lot of children. This might be a controversial opinion, but it has been scientifically backed. So, yeah, that is one factor.
Yeah, you are speaking about ADHD. What is the full form of
Yes.
ADHD actually?
Attention deficit hyperactive disorder. So this is a behavioral issue. It might be caused by environmental issues, but often it is something that is inherently present in a child. It can even happen in an adult. So this often goes undiagnosed because people just say, ki, haan, child is like that person is like that. But it is something that can be treated with, certain, if it is diagnosed, once you go to the doctor, tell them about these symptoms. There are certain criteria the doctor can tell you that this is ADHD. There is treatment for it. So, yeah, if a parent sees these signs in their child, it is always best to go get it checked and get it confirmed.
Yeah, okay. What one should do in order to discipline their own kid? Should they go in a harsh way, or should they speak in such a way that the kid will always understand the parents' language? What one should do in order to discipline their own kid actually?
So this is a very subjective opinion because every parent's experience with their child is very different. So what is harsh to one parent might be gentle to another parent. So I cannot say hard and fast that, yeah, harsh is the route to go or gentle is the route to go. But what I draw the line against from a pediatrician point of view is against, emotionally disconnecting from your child or being physically very abusive or emotionally abusive. Now, when I say abusive, it doesn't necessarily be like in a criminal way, but it can be something as simple as a child is crying and a parent is just letting them cry, not comforting them. This itself is like an emotional neglect that will cause issues in the child later on. So this I don't really advocate this as a method to, punish your child, or locking them in a dark room, which is a method sometimes that has been used. This again, as they grow, causes, fear, claustrophobia in the child, fear of darkness, irrationally, and can cause psychological issues down the line as well. So these are methods that I would not recommend. But as long as you say being harsh, so what I would recommend is a parent has to set certain boundaries that this is okay for my child to do, this is not okay for my child to do. And the child is going to test those boundaries. So parent has to gently but firmly say that no, today you're not getting this. You want it? I'm sorry, I cannot give it to you. In whatever method they can say without being very, in a way, abusive to the child. That's what I would recommend.
Yeah, okay. Speaking about darkness, what is the ideal sleeping time for a kid? What time should a kid start sleeping, and what time should a kid wake up? Because every kids do always cry during the night time, and in the daytime they do always sleeping. So, what is the ideal time for sleep for kids below 10 years of old?
Yes. Before I get to the answer, let me just compliment you on how you segue into the question. So, very good method. I like that.
Okay.
So, about the ideal sleeping time, this is again age dependent. In the first few months of life, the child is going to wake up every 2-3 hours, at least until 6 months of age. Thereafter, they start sleeping longer stretches, maybe 5-6 hours. They might sleep through the night also by 9 to 12 months of age. So, beyond 2 years, we usually expect them to sleep through the night. And the amount of sleep required is more the lesser the age. So a younger child requires more sleep, might require about 12 hours, 14 hours of sleep at the age of 2-3 years. As they grow older, that might reduce to about 8-9 hours, around 10-12 years of age. Now, another surge of increased sleep comes around teenage years because this is a growing phase. There are hormonal changes happening, and they actually do require longer sleeping hours than an adult. So, again, they may require around 12-13 hours of sleep. And then once they are out of the teen phase, it comes back to the adult scenario, which is like 7 to 8 hours of sleep a night. So this is usually the pattern. Of course, every person is different, so there might be a difference of 1 or 2 hours here and there for every person.
But most of the kids, most of the babies actually, like below
Yes.
1 year, they do always cry during the night time. And what makes the babies always awake during the night? Why are they not sleeping during the night time?
Right. So this is usually the issue in the first few months because when they are in the womb before they're born, usually babies are awake at night and asleep during the day in the womb. So once they're born and they're out in the world, that cycle continues, which is opposite to our cycle.
Yeah.
So now it takes them about 3-4 months to settle into our physiological cycle, which is sleep at night and wake during the day. So the reason for it, mother's moving around during the daytime, and that acts like a rocking motion, almost like a cradle, which puts them to sleep more during the daytime. And at night, when the mother is sleeping, the baby is just still. He or she is not sleep-inducing environment, so they're more awake during the night.
Yeah, it's like what to say. You're an American parent.
Kind of
They,
demand.
they, they do.
So they just drink about, few.
Yeah, go on,
Sorry?
madam. Go. Yeah, go on, go on, go. Please go on, ma'am.
Yeah, yeah. So the feed they take at one time is not sufficient to let them sleep for 7-8 hours. In 2-3 hours, their stomachs are empty and they want feeds again. So this again continues for about the first 5-6 months. And thereafter, like I said, the sleep intervals keep increasing 4-5 hours, 6 hours, 7 hours. So by the age of 2 years, they'll sleep through the night, 1.5 to 2 years. So yeah, these are the reasons why they wake up. Plus, again, they're very dependent on the parents for changing their diapers to make them comfortable. Sometimes the weather is too hot for them, the weather is too cold for them. So they can't speak words. So their method of communication is to cry and wake up.
Yeah,
So
okay.
that's why they do it.
Yeah. Yeah. How often should a kid be bathed by their kid? I mean, how often should a
Ah,
parent bath the child actually daily?
right. So in the first 2 to 3 months, in if it's winter, even an alternate day or every once in 2 or 3 days bath is sufficient. In the in between days, just a sponge bath with a warm wet cloth is more than sufficient. If it's summer, if it's humid, you can bathe the baby daily, no problem. So once the baby is about 5-6 months of age, we do recommend daily baths because there is accumulation of sweat, grime. They start moving around, they start crawling. So if, after that, it is ideal to bathe at least once a day. Again, it depends on the environment and the atmosphere, how it is. But yeah, after that, once a day is ideal.
Speaking about child injuries, so what is the common issue about the child injury? Like a parent is bringing the kid often to the hospital. Like many parents face the same issue. What kind of
Yes.
injuries should the kids facing right now?
Yeah, you're absolutely right. We see the same cases coming again and again and again in different people, but the same story. To mention a few of this, one is accidentally consuming some cleaning liquids or mosquito repellent that was just kept around. Things like that. Very common, extremely common. Another thing is dropping off some hot liquids, tea, coffee, hot water, hot food, accidentally drops on the child and they get burned. That's very common. Road accidents, too common. Even right now, I am like in the hospital treating almost 3 cases of road accidents where the child is severely injured. Very common. One more is unfortunately, drowning injuries. A child falls into a pool of water, a child falls into a tanker of water, was left unsupervised. Repeatedly, every few months, I have at least one or two patients who are come as a result of drowning. So these are the most common, and often it is just due to the simple fact that the child was left alone and nobody saw the child for just a few minutes. So just a few minutes can change the course of a child's life. So parents always have to be very vigilant.
Yeah, understand that we should be very cautious around the child. But what if the child consumes like mosquito repellents, like you are talking, and what if
Yeah,
they're choking, and what should we do in order to avoid poisoning? Because after a mosquito repellent is consumed by the kid, so in
yeah,
how much long time should the kid be treated? Because like consider around, we are just seeing the kid after consuming the mosquito repellents, like after 1 hour, and we are
after
bringing the
few,
kids to
yeah,
the
yeah,
hospital. So is it a
yeah.
sufficient time to just
So
bring the kid back to the normal situation?
yeah. So usually 1 hour is actually the ideal time. It's known as the golden hour after any sort of injury or insult or poisoning happens, because that is the best time to start treating. But anything beyond that doesn't mean that, okay, it's done, we can't do anything. Absolutely not. It's just that the effects of the poison may start after 1 to 2 hours. So by then the complications would be a little more. And the treatment also will be a little more complicated and take more time. So if a parent notices that their child has consumed something, they don't know when, it's better to just leave everything and take the child to the hospital right away, because staying at home, a lot of people do try to make their child vomit and all, but sometimes that whatever methods are used at home can actually cause more injury to the child, because people like put their fingers in the mouth or try to give excessive salt water, and in a child these can actually cause more harm than good. So when you bring the child to the hospital, we have more safer ways to take the poison out of the stomach. So it's best to just bring the child as soon as you can to the hospital.
Okay, what if the child starts choking because of a food consumed by the
Hmm.
child? What should we do
Right.
if the child starts choking?
Right, very, very common issue. So, if a parent notices this happening, so we have something known as a Heimlich maneuver for adults, which is, you go behind them, put your arms around them, around here, and just give a sharp pressure here, sudden sharp pressure, and the pressure on the abdomen will drop out whatever is lodged in the throat. Now, this will work if you have an older child, say about 8 to 10 years and higher. But if you have a child much younger than that, an infant or a 1 year old, 2 year old child, you can't do that. They're too small. So let's say this is the face of the child. This is the body of the child. We'll put the child on their stomach like this, face down, and hardly thump, like the hard thump
Part
on
with
the
the kid.
back. Yes,
Okay.
very hard. At this point, we're not going to think, oh, it's going to hurt my child. No, the child is going to die if you don't do this. So do it hard, thump them on the back, and that pressure itself will usually bring out whatever is lodged in the throat of the child. So this is what, and this is not the time where you may have time to go to the hospital. So do this at home. Still, if it's not working, then yes, rush to the hospital. But usually it works if done correctly.
Yeah, other
Another
than,
point to keep in mind, yes.
yes, tell me, ma'am.
Yes, to add to the prevention of this is to just be very careful of the small parts that are present in toys or in just your regular household items. Child-proof your house as long as you have a toddler. Avoid giving them these small nuts, small pieces of fruit, seeds. Avoid giving all those things until they're at least about 5 to 6 years of age.
Okay, other than that, what are the things we should do in order to avoid flu, diarrhea cases in child?
Hmm. Hmm. So, let's get one thing on the record that no matter how much you try to prevent, at least a few episodes are going to happen in the child. So, nothing to panic. But yes, prevention is possible. The main way that these infections spread is one, through the air. So somebody is already having it and you're around them, and that gets spread to the child. Secondly, through dirty hands. Person goes out, they've been everywhere, they come home, they handle the child without washing their hands. The germs on the hands of that adult is transmitted to the child. Now this germ may not do anything to me because I'm grown, my immune system is stronger. This same germ on the child is going to cause severe cough, cold, even pneumonia. So preventive measures would be to wash your hands as soon as you come home frequently. If your child is feeding themselves, make sure they wash their hands every time they eat, come from outside. if you're sick at home or if you know somebody who's sick, don't let them go near your child. Just be very honest and be like, no, I can't have you near my child. They're gonna get sick. Things like that go a long way in preventing these illnesses.
Yeah, again, what if a child is undergoing any depression or if they're in anxiety? How should one parent identify that their own kid is in depression and their own kid is in anxiety mode, and what one should do in order to prevent that?
This is an excellent question because a lot of people don't think about this. So this is becoming more and more common in the teenage years of a child or even in the preteen years. So, a parent may not get these direct signs that, yeah, my child has anxiety or depression. It may not be that easy. But if you notice a change in their behavior, it could be something as simple as they're talking much lesser to you. They're staying more in their room. They're staying more in bed. You have to force them to do some activities that previously they used to enjoy. Maybe it was a sport, maybe it's music. Previously they used to go enthusiastically, now they're not. Signs like these, or maybe they're under eating or overeating compared to what they used to. So these are a few signs if a parent notices. Instead of yelling, shaming the child, it's best to start analyzing maybe there's something going on in my child's mind that's causing this. So talk to your child, and if required, seek help. Go to your pediatrician or go to a psychologist, and this is very, very much treatable. So people should remember that.
So all these kind of things can be done to a fully grown baby, like with a proper development. And what are the things that one parent should do for premature kid? Because nowadays a lot of kids are born in a premature way. And what one
Yes.
should do? Is there any kind of separate care we should give to the premature baby than a normal baby?
Yes, definitely there is, because they are a very different type of child that you're going to bring for a while. So the difference between a premature baby and a full-term baby is that the premature baby is born almost at least 4 weeks before the given date. So what we say 36 weeks of pregnancy. Beyond 37 is a full-term baby. So the issues that can occur with a premature child is that they will have lower weight. They may have difficulty in breathing because their lungs are not fully formed. They may not tolerate feeds completely. They may not even be able to take breastfeeding because the muscles of the mouth are not fully developed. Their neurological system is not fully coordinated. So definitely a lot of them do require hospitalization in the first few days or weeks. After they're brought home, there is special care required because you need to keep them warmer. They cannot maintain their temperature. They don't have enough fat. Like you see a healthy newborn and a premature baby, they hardly have any fat. They can't maintain their temperature. So the special care that would be required is keeping them warm more than you would have to do for a full-term baby, because these babies don't receive it fully from the mother because their pregnancy is cut short. So those last few weeks where the mother's nutrients are passed on to the baby, that is completely missed out in these premature babies. Secondly, they do require regular eye checkups, hearing checkup, their developmental checkups regularly because they are more at risk for having issues in these areas. So at least until 2 years of age, parents have to give a little bit of extra care and be a little more careful with these babies. But yes, most of them do grow into very normal, very well functioning children later on.
Yeah, okay. We have discussed a lot of questions regarding this childhood development and issues related to kids. So, speaking about personal struggles, I just wanted to know about your personal struggles, which led and which will be a guide to the other people in order to become a successful child pediatrician to you. Because what are the issues you face, what are the struggles you face while studying and while you're acquiring a job, and what one should do in order to avoid all these kind of struggles, and how one can develop oneself to become a successful child pediatrician in one's life.
Yes. So, I think one of the most important things is that if somebody really wants to do this, then they should get in the field because it's not easy. Not just being a pediatrician, but being a doctor day and age is not a simple task, because just getting through into the field through the entrance exams is become very competitive, very mentally draining. Now, about getting into the field of pediatrics, compared to other specialties, I would say one thing that is really required is a lot of patience, a lot of tolerance, a lot of empathy towards the child, towards the parents who are going through the illness or the difficulties with the child. Not that it's not required in other fields, but here it is a step further, because if you're treating an adult, you can directly speak to that very patient and tell them or talk to them. But in this case, you're dealing with two parents, so you have to calmly, assertively talk to them, help them feel that they are understood, help them understand what they're going through. So that is definitely required. And as for personally, it is draining. You have to sacrifice a lot in your youth in terms of maybe people in other fields, in not a medical field, might rise in their 20s, mid 20s, late 20s, and might even be at a very high position. Because the medical education is so long, we're still training, even in our late 20s, sometimes early 30s, mid 30s. So a person has to be mentally prepared for that, physically prepared for the long working hours. Sometimes it's 24 hours, 36-hour shifts. So these are things that I did struggle with at some point and feel that, okay, this is getting a little too much. I have no time for myself, for my family, for my personal life. Thankfully, now I've come to a better phase after all the training is over. But if one wants to get in the field, they have to consider all these points before getting in.
So you have to have a proper motive and you have to have a proper training struggles. You have to face a lot of issues. I understand, ma'am. By the way, do you need to convey any message via this interview to the people in this world? You can directly convey, ma'am. So this is the right time.
So I don't know about the people of the world, but I will direct it to people who are related to my field, which are parents, children, teenagers.
Okay.
I aim through what I'm doing, like I've been more active on social media recently also. I aim to give them certain knowledge that previously was not easily available to a non-medical person. And that is why a lot of small things used to create panic in a parent's mind. And I did this because in my day-to-day work, in one single day, I would have about 10 parents coming with the same question. And I found myself repeating the same answer, the same reassurance to different parents. So I decided, okay, if I'm doing this in person at my workplace, why not, help other parents who might have the same questions. So my message would be that, educate yourself in terms of get all the knowledge you want for parenting, to take care of your child, get all the knowledge you want. But after all, parenting is a personal journey. Everyone's journey is going to be different. So take all the information, use what applies to you. There is no set rule that this is only correct, that is only correct. So do take all the knowledge, do what applies to you. That's what I would say.
Yeah, that's a great answer by you. So once again, I'm thanking you for accepting my invitation and coming to this Women Today Zoom video call interview. Thank you, Dr. Priya Sakte, ma'am.
Thank you so much, Krishna. Thank you for having me. I'm honored. Thank you.
Yeah, okay. So I'm really happy to have doctors like you attending my Zoom video call interview, and it's really a great pleasure for me. And please do subscribe to our Women Today YouTube channel in order to get, in order to see many women today who are excelling in different fields in this modern world over here. And please do like, click the share button, and please do comment something which you wanted to tell to this world, ma'am. So once again, I'm thanking you and signing off. This is Krishna, and had a wonderful time with you, Dr. Priya, ma'am. So once again, thank you very much and have a wonderful day, ma'am.
Thank you, Krishna. Likewise, and same to you.
Thank you, ma'am. Bye-bye.